Quality improvement in surgery. Quality improvement QI in surgery is a systematic approach to enhancing patient care, safety, and outcomes by identifying gaps, optimizing processes, and implementing evidence based interventions. It encompasses a range of strategies, tools, and methodologies to ensure high standards of surgical practice while minimizing errors, inefficiencies, and complications. Key principles of quality improvement in surgery. 1. Patient centered care. Focus on improving the surgical experience and outcomes from the patient's perspective. Emphasis on patient satisfaction, shared decision making, and informed consent. 2. Evidence based practice. Adopting guidelines and protocols derived from clinical research and best practices. Continuous integration of innovations and new technologies. 3. Systematic approach. Utilizing structured frameworks such as Plan, Do, Study, Act, PDSA, cycles, or Lean Six Sigma methodologies. Identifying root causes of inefficiencies and errors. Multidisciplinary collaboration, encouraging teamwork among surgeons, anesthesiologists, nurses, and allied health professionals. Involvement of hospital administrators and policymakers. Aims and objectives, reduce surgical morbidity and mortality, lower the rates of complications such as surgical site infections, SSIs, deep vein thrombosis, DVT, and postoperative sepsis. Enhance patient safety, address preventable errors like wrong site surgery or retained surgical instruments. Improve efficiency, optimize workflow to reduce operating time, hospital stay, and costs. Ensure compliance with guidelines, adherence to protocols like the WHO Surgical Safety Checklist. Monitor and evaluate outcomes, use of clinical registries and audits to track performance. Strategies for quality improvement. 1. Preoperative measures, standardized preoperative assessment, enhanced patient optimization, e.g., managing comorbidities, prehabilitation programs, implementation of preoperative safety checklists. 2. Intraoperative measures, adherence to aseptic techniques, use of advanced surgical techniques and technologies, e.g., robotic surgery, minimally invasive procedures. Real-time monitoring of vital signs and surgical parameters. 3. Postoperative measures, effective pain management protocols, early mobilization and enhanced recovery after surgery, ERS protocols, prevention of complications through proactive monitoring. 4. Use of technology, integration of electronic health records, EHRs, for seamless communication and documentation, utilization of simulation-based training for surgeons and staff, telemedicine and remote monitoring for follow-up care. Measurement tools for quality improvement. Clinical audits, regular evaluation of surgical outcomes and adherence to guidelines, identification of deviations and areas needing improvement. Key performance indicators, KPIs, metrics like infection rates, readmission rates, and mortality rates. Patient-reported outcomes, feedback on patient satisfaction and quality of life. Benchmarking, comparison with national and international standards to identify best practices. Examples of quality improvement initiatives. 1. Enhanced recovery after surgery, multimodal approach to reduce postoperative complications and hospital stay. Incorporates prehabilitation, minimal fasting, and opioid-sparing analgesia. 2. WHO Surgical Safety Checklist, a simple tool to reduce errors and improve communication in the operating room. Focus on preoperative verification, intraoperative communication, and postoperative evaluation. 3. Infection control programs, strict adherence to sterilization protocols, use of antimicrobial prophylaxis and surveillance systems to monitor SSIs. 4. Team-based training, introduction of crisis simulation and communication training for surgical teams, implementation of timeouts and debriefings. Challenges in quality improvement. 1. Resource constraints, limited availability of infrastructure, funding, and trained staff in low-resource settings. 2. Resistance to change, resistance from healthcare providers due to ingrained practices. 3. Data limitations, lack of comprehensive data collection systems in some institutions. 4. Sustainability, ensuring long-term adherence to QI measures requires ongoing training and monitoring. Future directions. 1. Integration of artificial intelligence AI, use of AI for predictive analytics, surgical planning, and real-time decision-making. 2. Personalized surgery, tailoring surgical approaches based on genetic and individual patient factors. 3. Global collaboration, sharing QI strategies and success stories across countries and institutions. 4. Sustainable practices, focusing on environmentally sustainable surgical practices to minimize waste and carbon footprint. Conclusion. Quality improvement in surgery is a dynamic process aimed at delivering safe, efficient, and effective care. By fostering a culture of continuous learning, embracing innovations, and addressing systemic challenges, healthcare providers can achieve significant advancements in surgical outcomes and patient satisfaction.